snot.
Snotty nose.
Yeah.
Yeah.
I'm Dr. Jing Cardona. I am a family physician and I am the owner and medical director of Cardona Direct Primary Care, which is a primary care practice that practices a different payment model in Jacksonville, Florida. Direct primary care is really getting back to the basics of primary care. It is modeled around small town medicine. If you think about small town medicine, one physician and your patient, and that's it. That's all that needs to be. Whatever system we can find that eliminates as many barriers as we can to just have more time with the patient and be directly involved with the patient, that's the system we need to be in. I am a fully trained family physician. I was a family physician in the military as an active duty medical officer for 10 years. And following that, I was in a traditional primary care outpatient setting for 8. I decided to leave my old practice and move towards direct primary care because I realized that the patient-physician relationship was deteriorating and I needed to find a way to renew it. And this was the way. Direct primary care is a different way of paying for primary care services, which is a subscription-based model where patients pay monthly for primary care services and we don't take insurance. It's traditional primary care. All of your preventative medicine, every visit is covered, from your annual visits, your healthcare visits, your urgent care visits, anything that would require you to go to an urgent care clinic, from your sprains, your cuts, procedure visits, minor procedure visits. I would probably argue that most primary care doctors did not choose primary care to be the wealthiest physicians there are. We did it because we wanted to treat the patient. The benefit of SBDC has been, it's been very grounding for me. It has been informative. It has been very constructive. It's been educational. I'm not very business savvy. I went to medical school, not business school. I didn't know anybody else who had started a small business. I didn't even know an accountant. And so I needed someone. I needed some person, entity, organization, group, some resource to be able to ask simple questions and to not feel like I didn't know what I was doing. I needed not only to have somebody help me succeed, but to help me not fail. And those are two very different things. This was all very, very challenging. It was a very steep learning curve. So to have someone walk me through creating a business plan and goals and having all of that down on paper was huge, was monumental. Every day I can do it with my eyes closed, but like when you're trying to curate. And then to add meat to it, and then to refine it. And then beyond that, once I had that and once I felt comfortable with that, then it was promoting and marketing and web design. I can't think of a single reason to not use their resources, even for one question. There has to be one question that they can answer for you. One. But I'm sure there's 50 or 100 questions that they can help you with. Jaime and SBDC has become integral to my business, has developed my business to what it is now, and I am grateful.